I'm Kathy Weaver, and I'm Executive Director of Guidepost of Strength, and welcome to you all. Our topic tonight is Hit by a Mack Truck Part 2. Truth be told, we could probably have 12 sessions of this because we could probably all have enough topics to go with this. But we did Part 1 last month, and tonight we're going to look at several other aspects of the cancer journey, some of the side effects, and just some of the real-life situations that come with having cancer. Before I get started and tell you about our evening, I wanted to let you know that our roving photographer Ron here will be taking pictures throughout the evening. Ron does this for us out of the goodness of his heart and in memory of his father. And but if you would prefer not to be in a photo, if he gets close to you, just kind of do like this and just let him know that you prefer not to be in it. We use our photos on our Facebook page. We may use them in grant proposals. We use them, may use them on our website. And we'd just like to show people that we're not, 2 feet in the grave. We're healthy, active, living, and it's just, you help us out a lot when you let us take your picture, but we respect it if you decide you don't want yours taken. So when Ron comes around, and he's very subtle, just let him know. I'm not going to call you out in front of everybody. Our dinner tonight is provided by Millennium. It's a pharmaceutical company, and they have graciously paid for the meals, and that's how we can bring them to you free of charge. So we really do appreciate that, and they do a good job, and the food is really good, I think. So our appreciation to Millennium. I'm going to tell you one more thing, and I'll mention it afterwards too. On Friday, May the 29th, in that room right back over there, our operations director, who also coordinates our volunteers, Michelle DeWitt, who is behind, she's over here behind the column, but I know she's over there, is going to have a volunteer orientation. If you'd like to volunteer with GPS, we have a lot of opportunities that are actually very engaging and very fun, and it kind of helps all of us through the cancer journey to do that. But if you're interested, please get in touch with Michelle. I'll mention this again at the end of the program, but think about it. We have all sorts of opportunities, from helping serve at our programs like this to photography, videography, general operations, even mentoring in the chemo room and on the cancer unit. We can use you. We really do appreciate it, because the lessons you've learned on the journey are important to pass on to those people who are getting ready to hear these words, you've got cancer. And as I've told you before, we are made for and by cancer survivors and co-survivors. The co-survivors are those people who are loving you through it, and we take you as volunteers too. So equal opportunity, we'll pull you all in. We don't turn it, we do, well, we are discriminating, but we probably won't turn you down. Tonight, we're going to look at several different issues of the collateral damage, is what we called it last year, of the cancer journey. Our first speaker tonight is Dr. Micah Copeland, right here, and Avis Murphy. Avis is a survivor. Dr. Copeland, the two of them together are going to talk about managing pain effectively. Regardless of where you are in your cancer journey, pain can be an issue, even if it's tugging scar tissue from surgeries, or if it's bone pain related to a treatment or to the disease itself. It's really important to keep that pain under control. We're going to do that for about 20 minutes and then leave about 10 minutes for questions and answers. At 7, Adrienne Sledge over here is going to talk about taking care of your skin before and after cancer, because if you've had cancer treatment, you know that the skin takes a beating. And Adrienne's going to bring us one of her great programs again. 7:30, you're going to get a chance to choose between 3 different areas. One is Tony Hill. Tony, raise your hand. There we go. Tony has spoken with us before about dental health during the cancer journey. Tony is great. She'll be back. She's here tonight to help us. Stephanie Ream. Is Stephanie here yet? She's not here. Not here yet. Okay, Stephanie's going to talk about lymphedema, and that's a real important issue. We're going to be back in this room with lymphedema, and then Janice Wakefield, and Janice, there we are back here, is also going to talk about, she's going to talk to the caregivers about caring for yourself when you're caring for someone else. And that is critical, people, because I'm just going to give it to you one idea I heard. When an airplane is in trouble, the pilot was taking care of everybody on that plane, who does he give oxygen to first? Himself, exactly. So you caregivers, Janice is going to help you through this. She's going to help you with some oxygen for this journey. You need it. Alrighty, I'm going to turn it over now to Dr. Copeland and then to Avis. Thank you very much.
Thank you for the opportunity to be here. Avis and I have talked a little bit, so I'm going to sort of start off and talk a little bit about the general, how we approach it from a medical standpoint, managing your pain effectively, I think was the topic that I was given. And so I want to just, by way of introduction, tell you a little bit about my role here. I'm here in the Cancer Center. I'm the palliative care provider. And I want to just define that a little bit so that I know that term sometimes is sort of a difficult one for people, and it's one that's often misunderstood. So one of the pieces of what I do here in the Cancer Center is symptom management. And what that means is any kinds of symptoms that come up with your cancer or with your treatment are things that I can help with, that I may come alongside your oncologist and help manage on the side. So cancer care, the model that we're trying to use here is really sort of a team approach. And so that's how we try to approach pain, and I'm going to sort of talk specifically about pain. Palliative care in oncology is a field that is really new. It's developing rapidly, and I'm part of that team here. It's part of the your oncology support team here at Hayward Cancer Center. So in terms of pain specifically, lots of different people may talk to you about your pain or address your pain. Your oncologist, certainly, through treatment of your cancer. The radiation oncologist or radiation therapist may be involved in your pain treatment. The internist, who here some of you may have had contact with Dr. Barry Seltzer in the oncology area. But there are also other people that may get involved, and I'll list some more in a little bit here. Pain can be part of anybody's cancer journey, but it's not always the part. It doesn't always have to play a role. So if you don't have pain, may not be unusual. The same cancer in two different people may give very different symptoms. So that's a good thing to remember. Each person is an individual. So how do we approach? I'm just going to give you sort of a quick overview of how we approach and evaluate pain. We ask lots of questions. And sometimes that can be frustrating for patients, because if you see especially several different people, they may ask the same questions to try to wrap our minds around what kind of pain is it? What's the location? What's the quality of your pain? What brings it on or relieves it? Whether what you've done to relieve it, how that is responded to. So it's really to help us figure out what is causing your pain. So, and what tests we may need to order to clarify what the reason of your pain is, and what treatment will be most effective. So the workup may reflect, we think this pain is due to a change in your cancer, so we may need to do certain tests. Or it may be a workup to sort of determine what treatments may be best. To really clarify, you may have heard us use different terms like, is this somatic pain or visceral pain or neuropathic pain? I think someone said last month, you all talked a little bit about the neuropathic pain. And these are different ways that as a physician we look at it, and it helps us to tailor the treatment better. So there are different treatments depending on the cause of the pain. It's good to remember that humans are complicated, and that there are many factors that play a role in pain. Factors that may contribute may be social, they may also be spiritual, they may be psychological, they may be even financial problems that contribute to the perception and the tolerance of pain in different people. So these are all important aspects to remember, and reasons why a lot of times we'll ask lots of questions. Of course, treatment, when it comes to treatment, the main thing that people think about is medications. And that's of course one thing we use predominantly, but there are many different kinds of medications. So depending upon what kind of pain it is, we may choose a different medication. And then there are non-pharmacologic treatments. So we may even use a neurosurgeon or an anesthesiologist. A lot of the anesthesiologists have a special interest in pain and may have certain skills to perform certain procedures. I think we'll hear a little bit about that. Also, addiction specialists sometimes need to get involved in pain management because of the types of medications that we use. Sometimes we run into addiction problems that need to be addressed. Mental health specialists may get involved. Complementary therapy specialists, like physical therapists or even chiropractors, acupuncturists sometimes can be good in terms of non-pharmacologic treatments. Rehab specialists have interest sometimes in pain management and can be very helpful in an adjunct kind of way. So remember, not all pain is equal. Not every patient is the same. And what works for one person may not work for another. So as you're comparing your stories, it's always good to support each other, but also to realize that each person is an individual, and so we take a team approach. So I'm going to let Avis share some of her story, and then we'll field some questions.
Well, I know I'm not the only person in here who has experienced pain as it relates to our cancer journey, but I expected some level of pain as I entered it. I started out with a lumpectomy and then went through bilateral mastectomies, and I was raised for several years by my grandma, and she's a tough cookie. So grandma always taught me no complaining. I mean, I went into my senior year one year, and you don't even tell grandma you don't feel well. So I went into the school nurse, and I finally went to the nurse and said, I don't feel well. And she looked at my ear and she said, honey, your eardrum is about to rupture. You need to go to the doctor. So, I mean, this is how grandma raised me. So I never complained throughout the entire thing, even when I was in pain. So I expected the pain, I endured the pain, but I also learned that I did myself a huge injustice by not telling my doctors that I was in pain. And I know that I'm a superhero in my children's eyes, but I didn't have to be a superhero through this cancer journey, and I really did myself a huge injustice by not complaining. So by the time 8 months was over, and I was still experiencing pain and could not even fold a towel without feeling like my arm was being sliced open, I knew something was wrong. And I went to, I received my treatment through Baptist. And I went to a breast care specialist there, and she's put me on gabapentin and nothing touched it. Long story, I went to the pain clinic, and after medications and more medications, and a nerve block that went awry, and I got a chest tube, and another nerve block that didn't work, and a nerve ablation that almost resulted in another chest tube, and another nerve ablation, and we waited for the MRA safe lead spinal cord stimulator, which I do have now. We are still playing with pain relief. It is an ongoing process. And what I have learned through this, because I am not the person to sit back and let life happen, I have learned that by saying that I'm in pain doesn't mean that I'm a failure. I have learned that by grandma telling me to tough it out, doesn't mean that she's wrong, but it doesn't mean that I'm a failure by saying I'm in pain either. So I heard a quote which actually prompted me in the direction of, I'm trying to just skirt over this very quickly because I want other people to be able to share as well, but and I have some tips in this, but there was a quote that kind of like jabbed me in the direction to receive the help that I needed to go out and get the relief that I knew was out there. And the quote, I'm sure everyone has heard, pain is inevitable, but suffering is optional. And I was in that state of suffering. I was past that point of just feeling pain. I was suffering day after day after day. I was crying every weekend, all weekend long. I was no longer able to even get out of bed because I couldn't fold a sheet. I couldn't fold a towel. I couldn't get up and swing my arm walking down the hallway. I couldn't put deodorant on my armpit. But what helped me when I went into the pain doctors, I had kept a journal from day one. I kept a journal of describing what the pain was, whether it was burning, radiating, stabbing, aching, slicing, tearing, prickling, tingling. The way I described it was an ice pick in my armpit, a heated cheese grater at my side, and a slicing, burning knife in my arm. And then there were triggers. Did it happen when I reached over my head, to my side, behind me? What triggered it? And then how I was able to get relief. So these were all very, very important. So, and then you can also keep track of in this pain journal the degree. Now, very quickly at the pain clinic, they realized if I put a 6, most people would put a 12 on a 10-point scale. So they realized very quickly my 6 was most people's 12. My 3 was most people's 8. So I had a very high pain tolerance. But keeping a pain journal is very, very important. So when you go into your medical providers, you're able to say to them, "Hey doc, I'm hurting." Well, what are you hurting? Where does it hurt? What's causing it to hurt? What does it feel like? And if you can't describe it, say, "It feels like, when your mama gave you that switch on the back of the leg?" Yeah, kind of like that. However you can describe it. That's what you need. You need to be able to describe to the best of your ability. And I think it's really important that you know your pain is yours. There is no right or wrong. It's yours and it's real. I think at the beginning for me, when I started reaching out and saying I'm in pain, there were a couple of my medical providers, not here, who looked at me like I was nuts. They told me, one in particular, "I didn't do anything that caused you this much pain." Really? But I didn't accept that. And I think because of my personality and that, I know that my new normal is a new normal, but I'm not accepting that that's going to stay my new normal. I want something better. I'm always striving for something better. I'm always seeking out new. I'm always seeking out better. In fact, tomorrow I have an appointment. We're still playing with medications right now. I have an appointment tomorrow at my pain clinic. I have things I found out that Baptist has. I've been diagnosed with post-mastectomy pain syndrome, and it's probably one of the most severe cases that people have seen. And in the last year, they put a team of experts together at Baptist. And I just found this out in the last couple of weeks. Well, when I go to the pain clinic tomorrow, I'm going to look at my doctor and say, "Hey, how often have you consulted with this team of experts that Baptist has put together?" I get to say this to them because now I know. I mean, this is exciting. So, you have to be your own advocate, and you guys, the people in this room, you know that. I think it's also important when you're going through this process and dealing with your pain is to be very honest with your medical providers. I'm going to be very vulnerable here for a moment. When I was going through a lot of my medications and trial and error, I became dependent on one of the narcotics, and I didn't want to take it at one time. I mean, I refused to take it, and my doctor looked at me and he found out that I had been sitting on the couch crying, and instead of taking it on regular intervals, he said, "Why are you doing this? Don't you want to be out there and enjoying life with your children? Wouldn't you rather be out there watching your child playing lacrosse? Wouldn't you rather risk this dependency and enjoy life for a little bit, and we'll deal with it later if this happens?" Yeah, and we had a 20-minute conversation over this. And yes, I became dependent, and we dealt with that later. It was humbling. It was very humbling. And I'm letting you into this vulnerability of mine. And because taking narcotics or pain meds, if that's what your kind of pain is called for, it has a stigma to it, but it's worth it if that's what it takes to get through it. It's a time of life. It's a season of life. So anyway, I've been through quite a bit. It's an ongoing process, and I think that's, for me, chemotherapy, there's an end in sight. You had an end. Surgeries, you had an end. Pain, there's no end with the pain. I think for me, this has been the hardest thing with the whole cancer thing. Cancer's over, but the pain is ongoing, and I think that has been the absolute hardest, because at this point in my life, it will be for the rest of my life. But most people who look at me, they don't see that I deal with chronic pain. It is debilitating if I allow it to be, but I won't. So anyway, I'm gonna let you guys share.
And I'm going to sort of moderate it. If you've been before, you're probably used to that. Avis, we really appreciate your candor, because I think a lot of you, I could see people nodding their head and understanding. Avis is one of our most active volunteers, and you would not see this. She's here working in the resource center. She's helping us with events like tonight. And the bottom line is, what we all want is to live as much as we can with this disease. And if it's for the next 30 years, for the next 6 weeks, that's what we all want to do. And if that means managing pain or lymphedema or skin problems, whatever it is, hearing, vision, that's why we're here together. And so I really appreciate what you both have said. Love to open it up for questions right now. We're going to take questions to 7, and then we're going to switch over to skincare. Yes?
I didn't have a question, but I was what she was saying about acupuncture and chiropractic. Most doctors think that's voodoo medicine,
right?
And so they don't accept it. But hey, when you're going through the pain,
yeah, and those are adjuncts. Those are things that can help some people. They may not help everyone. It's a multi-disciplinary approach to trying to address the pain from different angles, because it's not all due to just one thing.
We were talking about that just before the evening started, and that I've discovered if I'm tired or if I'm stressed physically or even emotionally, my pain levels skyrocket. And things like acupuncture, chiropractic care, even massage therapy help with that whole body, mind, and soul thing that we've addressed in here several times. It really, like you were saying, it's adjunct. It works together.
I haven't had a mastectomy, but I'm curious, is the pain coming from where nerves were damaged? That's kind of what I was thinking. It's like, what's causing that pain? Is it just the permanent nerve damage?
Permanent nerve damage, yes.
I've been cancer-free now 8 years, but extreme head damage to my bladder, and L1 through L5.
Okay.
And I have pain with it, I just have to deal with it. Ain't much to do.
Right, and that's true. I mean, you will have to deal with it probably for the rest of your life, And I think one of the things I want to sort of highlight that you said, Avis, is the honesty factor. I think a lot of times what we talk about in medical care is that patients, there's this dynamic of patients wanting to please us as the provider and not show that there's true symptoms. And I want to caution you that that's not helpful. We need you to tell us honestly, because otherwise we can't really help you. Whether it just needs to be open, honest communication.
I did something kind of stupid after my second mastectomy. I didn't like the feeling they gave. I was going through reconstruction at the same time, and the doctor had me taking Valium because it relaxes the muscles, and the breast reconstruction and implants are underneath the muscles. Anyhow, I took the Valium, but it kind of gorked me out, and I was on the couch for days. And I didn't like being like that, and I found it very depressing to not get up. But I still hurt, and I didn't want to take the big pain meds because I didn't want to be gorked out. That's probably not a word, but I spent what seemed like weeks, it was more like days, on the couch. I switched, without talking to the doctor, I switched to Tylenol. And I took a lot of Tylenol. And what the Tylenol did, and I didn't realize it because I was so down and I felt so bad, is I had a raging infection in this side of the surgery. And I felt so crummy, but the Tylenol masked my fever. Okay, so I hid a big symptom. And with my first mastectomy, and I'll get a little personal here too, I had hemorrhaged. It was not the doctor's fault, it was another medication. So this side was black and blue. So when this side turned red, I didn't think that was different because I wasn't quite sure what normal should be. And frankly, the infection made me feel crummy, and I just wasn't thinking real clearly. But switching to Tylenol, not telling anybody I was taking it constantly for the pain, masked a really bad infection that eventually they got cleared up, but it took 2 surgeries. So be really clear with your doctors. And if for you caregivers out there, pay attention when you see symptoms. I mean, you know, if they're not their normal selves, and my husband he called a friend of mine in from Wilmington, and he made me get up and go to Winston one day, and I went crying and doing other things that were not present because I thought I don't feel like going, and it made me get up and keep going. So caregivers, when you see them acting differently, then you know that that's their character. I mean, they get a free pass for a few days, but notice it and talk to the doctor too. Let them know that there's a red flag. Anybody else? Yes.
Hi, it's Stephanie. Is it uncommon for this is the side that I had the cancer. I had a double mastectomy. The radiation in 2013, I had like 30 on this side, and it still is hot. It stays hot.
Yeah, I mean, there are side effects that can last for a long time or probably forever, you know, related to the treatment. Neuropathy related to chemotherapy, you know, is a big side effect. Pain, neuropathic pain as a result of chemotherapy. I'm sure some of you have experienced that.
Yeah.
Radiation can certainly give you a neuropathic kind of pain or even skin pain for a prolonged period of time. Sometimes it never goes back to normal.
Yeah, because when I exercise, I can always feel it pulling in here. So, I mean, exercising for almost 2 years, I'm still pre-pull machines, lifting 20 pounds. And I used to lift 50 plus pounds all day long in my job I had to resign from. And after the chemo, the ribs in my back, they still haven't stopped hurting. So, I don't know what's up with that. So, that's all I gotta say.
Yes,
I'm
ma'am.
here for you.
I just would encourage everybody to don't hesitate to say, no matter how minimal pain that you think you're having or whatever you're uncomfortable with, to be sure and talk with your oncologist about it. I don't have a pain, but I have a very uncomfortable sensation from my mastectomies because I feel like my skin is super glued to my chest. And I can't get away from that. It won't go away. And so we're looking into, I've mentioned it, and we're looking into some other options that might help.
I'm amazed, just at standing up here moderating, the ability all of you have to voice the way you feel. It's pretty, I mean, isn't that an incredible description? And that's, let your doctors hear that. Amen to that. That's just, and you know what? I'll tell you a secret. When we leave these programs, the speakers who present each month come to us afterwards and they say, you don't know how much I learned tonight from the people in the audience. Every single time they tell us this. In fact, Dr. Seltzer is one of our biggest champions. He comes, basically it's like a continuing medical education for him because he learns so much from everyone out there. These are things that are not in all the textbooks because you're living it. And that's a lesson that's vital to all of the care providers. Anybody else? Well, we want to thank you both for coming. This was great. They'll be around later on, but we're going to switch over to Adrian. But first, I want to thank you. Really helpful and informative. Adrian Sledge is up next. If you need to stretch a little bit, you can. I'm sure Adrian won't be upset.
I won't be upset.
And
actually, I'm used to standing, so would you be offended if I stand?
And I'm going to let you introduce yourself.
Okay.
And I know I've heard you before, but I'm going to let you do the talking.
for those of y'all who do not know me, and obviously I'm very Southern in that regards, my name's Adrienne Sledge. I am the owner of Facial Experts here in High Point. I specialize in health and wellness of the skin, oncology skin therapeutics, and integrative wellness for diabetics. So basically I deal with a lot of people who have medical issues. I'm going to start out really basic because I can sit here and talk about skincare all day long. And so let's start off with a little bit of basic information. First and foremost, we were all taught in school that the skin is the largest organ. It's strong, it's waterproof, and it protects us from the outside elements. Healthy skin is supposed to be moist, smooth, soft, and slightly acidic. I guarantee you somebody will give me an answer saying my skin doesn't look like that. We all can say that at one degree or another. I will look at you and say, your skin's beautiful. And you may say, my skin's got a little bit of oiliness to it. I like it because it's a little acidic. I mean, we all have something. No, I'm just giving an example. But anyway, this particular system has several functions. One is a protective barrier. So it really protects us from the outside elements. It houses our nervous system, which responds to our touch, our pain, our cold, our heat, and pressure. So thanks for the skin that lets us know what's going on. It regulates our body temperature. When we're hot, it cools us down. When we get cool, it warms us up. It excretes waste. Great detoxifier, great elimination tool. Very important. This is one of the things you'll hear me say a lot about. And also it's a secretion tool. You know, when we're breathing in oxygen, our body allows it to discharge carbon dioxide. So we continue growing and moving on. Last but not least, with the absorption properties, it allows us to kind of store things in our bodies, like our moisturizer, to keep our skin nice and glowing and healthy. There's three basic layers of the skin: the epidermis, the dermis, and a subcutaneous level. As a skincare therapist, all I work on is the epidermis, which is the outer layer of the skin. That is my big friend, my love of my life. If you don't know this, by state regulations, all I can do is work on the outer part of the skin. I cannot diagnose anything for you because I do not have a medical background. So if you're here talking with me about your skin conditions, and I don't see something that looks quite right, I'll refer you to our doctors who will take care of it for you. I'm kind of like their go-between. If something doesn't look right, something doesn't feel right, you have a rash, you have a blister, something doesn't look like we want it to. Or you tell me and you don't tell the doctor. I let them know what's going on. So they have that little bit of information and they're able to tell you this is what we need to do. My main focus of my skin practice is how our skin functions and how healthy it is working. That is why in this conversation you'll hear me say these words over and over again: detoxification, elimination, stimulation, and activation. We are born with a skin type. Genetic and ethnicity determines what our skin type is. We all know what dry, as you told me, oily, normal, combination, and sensitive. So we're all born with one of those. As we get older, and of course, unfortunately, as we age, as I'm saying, our skin type changes into a skin condition. And many external and internal factors come and affect this condition of our skin, which of course is not a genetic response. As a skincare therapist, I'm actually seeing more condition issues, more so than the typical skin types. I'm seeing things like adult acne, hyperpigmentation, aging from sun damage, rosacea, dehydration, and inflammation. I think the reason why we're seeing so many of these issues is because, number one, our modern lifestyles. We're hard on our lives, we're hard on our bodies, we're hard on our skin. I mean, that's just common sense. Lifestyle, as we know it, is stress, insufficient diets, and no exercise. I mean, 9 times out of 10, if we hear somebody that's stressed out, they'll have a skin condition or an internal body condition, then we'll find out about it. We are not taking care of our bodies properly, which again, it shows outwardly on the skin. I'm just going to elaborate on something a little different outside the element of skincare. In my practice also, I actually based my holistic practice on Chinese 5 elements. Some of you guys might understand this process, some might not. Chinese philosophy has held that good health is a result of balancing the 5 elements in the body. This is what I call seasonal health and wellness. Behind each season, there's an elemental energy that can be supported. The 5 elements are wood, fire, earth, metal, and water. That little voodoo thing you were talking about earlier, that's me. I'm the voodoo goddess. Right now, we're in spring. And spring is about the season of new beginnings, new growth, and is actually represented by the wood element. This organ system associates with this season is the liver and the gallbladder. So as I'm talking, it's going to make a little bit more sense of what I'm stating. The liver and the gallbladder actually rules the movement of blood and detoxification. So this is the time of rising energy, and with that being said, think about the plants. We've come out of winter, we've been all cold and just huddled up. Then all of a sudden, here comes the daffodil popping up out of that ground, trying to get that upward and outward motion. That's what our body is telling us what we need to do. It's trying to wake itself up right now. It's tired of being dormant. It's tired of being cold. It wants that blood to come out. The sun's up. It's lighter, longer, got more energy. I have a little bit more pep lately. A little bit more energy. So we're wanting to come forward and move outward and move upward. Our body's doing the same thing. Right now, blood is actually coming out from the fatty tissues. So with that being said, it's trying to actually, the blood vessels are swelling, moving out from the fatty tissues. So it's trying to get rid of waste and toxins at the moment. Blood does start to thin. And with that, bacterial, viral, mucus issues starts to come out of the system also. Because our body's being affected by this element, I had mentioned the liver and gallbladder, because the body's detoxifying, it's going to show up on your face. A lot of us right now are experiencing probably a little bit more dead skin cells on the surface of the skin because your body's trying to naturally wake up. You break out. Believe it or not, unfortunately, I've been in that boat and my skin never breaks out. I'm going in some detoxification mode right now. But I have a little bit of breakouts. We're trying to remove waste right now. I will tell you also too, this time of the year, the spine, the limbs, the joints, muscles, ligaments, tendons, they're starting to hurt. Has anybody else been hurting a little bit this season?
I've been hurting all the time.
And part of the reason why we're hurting a little bit is because we're starting to move. I mean, I'm putting plants out right now. I'm outside enjoying the nice weather. I'm going on walks because you know what? I'm going to lose that 10 pounds before summer gets here. Hasn't happened yet, but it's getting there. So we're all moving. So the other thing too is anybody's eyes been bothering them this season also? Allergies, yeah. Allergies been acting up. It's a funny thing, and I hope I can put it in correct perspective. In the wintertime, the body comes inward and it closes up. That includes your eyes, even though we're really focusing out and looking. But during the spring, they actually open up and look out at what's going on and seeing things. So that's part of the reason why the eyes are hurting too. It does, growing up. Because of the spring season, I had mentioned a lot of us experience breakouts. We're sweating a little bit more, which is kind of nice. We're kind of getting our body moving. One of the things that we can help us do right now is to do a little bit of exfoliation because we want to get rid of those dead skin cells for this time of the year, this season. We want to detoxify. And I mean that internally and externally. I'm not saying go out there and get something that's just going to blow the whole system out, but we start eating fresh fruits. In the wintertime, did all of us eat like comfort food? Because we were hungry and it felt good and kept us warm. Now you're probably craving fresh fruits. Asparagus is out right now, which is really good. So we're definitely craving more things that are out there. This is also a time that you may want to change up your moisturizer because your skin actually, even though it may be drier, during this time of the year, it actually kind of wakes up a little bit and the oil glands are becoming more activated. So you may feel like the winter moisturizer you've been using, you can actually kind of step down a little bit. With that being said, always sunscreen, sunscreen, sunscreen. But on the oncology end of it, I had mentioned that I do specialize in oncology skin therapeutics. It's my job to maintain the functioning health and wellness of your skin. My therapies are preventative and preemptive care. And what I do actually is help your body slowly move toxins, which is the chemo, and waste through your body. Again, I said slowly. I don't rapidly do anything that just utterly change everything. The skin's an ecosystem. So this is living space right here. We got to take care of it like it's living space. Remember, it's the largest organ. Anytime there's a change in your ecosystem, there can be failure in the functioning of the skin. So mild activation of the surface, again I said that word activation, can help it detoxify and release waste and toxins. Our skin needs good bacteria. Just like your gut needs good bacteria, your skin needs good bacteria. We have good bacteria on the skin. Energy, water, I do sound like a daffodil here. Nutrition and homeostasis in the living space. A lot of you guys, especially going through cancer, you see dryness, chemo, acne. Again, something else that's just on the skin that's just not a good time. Rashes, inflammation, and actually shredded skin. The health and wellness of the skin is compromised. For my chemo patients, the protocol that I would actually recommend for you guys before starting in a regimen of chemo, first you have to get your skin in the best shape it can be. Daily cleansing, mild exfoliation, and moisturizer, and actually sunscreen. And make sure that your products are chemical free. Because you're already putting a chemical in your body to kill off what's there, why do you want to put it back in your system? And also too, 50 to 70% of us are made, well, we all are made of water, 50 to 70% of us. A healthy consumption of water would help you out, because you want to flush this waste through your kidneys and bladder. And as for my radiation patients, the same actually goes for you also. The one difference is because of going through radiation, you want to make sure the skin doesn't shred. So cool compresses and definitely a moisturizer or something that will help keep that skin moist. One of the things I will tell you, and I hear it all the time only because what happens, and whether someone has cancer or not, we all look at ourselves at one point and say, I'm not happy with what I look like. I need to do something radical. And I always have patients come to me and say, I'm getting old, I look old, I need old, give me a pill. I need retin-A, give me a pill, do something, strip off the skin. And again, as I say to them, one, we don't need to push your large organ and compromise it. If we compromise it anymore, it's going to compromise what's going on within your body. Remember that your skin is showing the world what's going on with you physically. And with my clientele, because I work so related to the gut and to the skin, that, again, as I go back to what I said earlier, the skin is moist, soft, acidic, slightly acidic, and it's healthy looking, it glows. And that's part of with going through cancer or going through chemo, we lose that glow. It becomes pallid. What happens is a lot of that chemo is sitting right there in that gut. And again, we need to move it through and get it out, the system out of the waste. I promise you, if I went around here today and asked a lot of people what they did with their skin and how they did things, a lot of you would say, and then I'm just giving examples, I'm just putting it out there. A lot of you would say, oh, I wash my face every day, which is fabulous. But do you put something behind it that actually adds moisture to it? Because you can't strip it off. I mean, you can't strip it off. The other thing I would ask too, if you guys use sunscreen. And I promise you, there's some of you in here who will give me a million answers that no. and for it, because I don't like how it feels. It's greasy, it's heavy. They don't like it. Just because, I just don't want to. I mean, I go to the beach for 2 weeks out of the year, and I come back, I look like this. But I'm out in it. I really am, and I use my sunscreen every day. With that being said, remember I told you I was clinical holistic. I believe in the sun, so I'm not telling you you can't go out there and love that big golden orb. It's just you have to be sensible about it. You have to be sensible about everything that you do. With that being said, definitely with your sunscreen, I would do. I don't know if anybody's ever broke down and told you SPS. Do you guys understand the difference in the SPS? 30 or above? 50. You use 50? Okay. The FDA says 30 and above. The reason I actually personally just use 30 because for me, the chemical aspects on that end, if it's higher, it irritates me. I use a physical sunscreen, which is zinc oxide, titanium dioxide. You can go up to, they do have one, I think, Neutrogena that has 100, which really they can't, yeah, I know, they can't block 100% of the sun, yeah. Yeah, so, but I will tell you, as you go up in the spectrum, 50, you're getting 1% more protection than a 30. So, for myself personally, I just use as less chemicals as I can in my body for that reason. Definitely make sure it's UVA and UVB broad spectrum because finally the FDA has finally cracked down on the companies, so they have to put in equal amounts of it. So that's one of the other things. And just reapply. Do not go out on the beach and put it on when you get there on the beach. Just like when you go outside mowing grass, don't do that either. Put it on before you go outside. Wait a few minutes, and I would say probably about 20 minutes. Put your clothes on, go outside and have a ball. 2 hours later, reapply again. So that would be it. I'm trying to think what else. I had mentioned the Chinese 5 elements. I will tell you, and I'm probably, as I'm standing up here because I can feel the heat on my gut right now, my little cheeks, my little chin red. Are they?
Yes.
Well, right now I am, menopause is just having a ball with me, and I am hot. Nothing I can do about it. But it's right here in my gut. I mean, I can feel it. I can feel this band of heat. If I'm reading someone's face and talking with them, my little cheek area is my stomach. My ear is my small intestine. Well, that's where my little gut is, right there. So that's the other thing when I was mentioning about Chinese elements. When I talk with everybody, I sit down and talk with you, and we go about what's going on. I read your information, but I also can see what's going on internally by what's going on externally. And it's little things. Again, the eye area is your allergies. Am I getting threatened here? Is your allergies and your kidneys. One, if you're in allergy season, your eyes are puffy or swollen or they hurt, it could be your allergies. But if not, I may ask you, are you drinking enough water? And the response 9 times out of 10 is, no, I'm not really consuming enough water. If we incorporate some water, flush the kidneys, we'll get it going. Breakouts along the forehead is your bladder, your digestion. If you have a lot of breakouts up there, I would say look at your diet. Let's change it out. And again, when I'm stating things, it's not saying this is actually what's going on with you. It could be an emotional aspect. I had a client that came to me and she said, my nose is broken out. I'm broken out of, right here above the upper lip. And knowing her history, I knew she didn't have any heart troubles because that's where the heart would be located if I was connecting the two together. I said, what's going on with you? She says, oh, my child's moving away. It's emotional. It's the heartstrings being pulled. Physically and emotionally, that our body relates to what's going on. And it really has, like I said, it shows up everything what we do to our skin. So. But anyway, that is it. I will tell you, I have presented you guys with bags. And in there is a sample of a product called Vital Repair Balm. And what I like so much about this particular thing is it is a holistic, organic product that you can actually apply. This as an eye cream. I know you guys are going, the gentlemen are going, okay. An eye cream, you can use it as a mask, you can put it on your boo-boos. On your boo-boos. You have a little bruise, which I started on mine. Boo-boos, put it on your little boo-boos. You can use a mask, or if you need a heavier moisturizer, you can do that. Anybody that's going through radiation, they can actually put it on their burns to help keep that skin intact. It actually, what it does, it reepithelializes the skin, so it actually asks for continuous cells to reinvent, and reignite, and re-going.
You're doing great on time. I'm just going to come up and kind of open this up to questions, because I bet there's some questions out there from people.
How do you feel about SDF clothing rather than sunscreen?
It's not covering your face, and it's not, I mean, are you covering everything?
I always use sunscreen.
Okay, but I'm talking about
I'm
the,
talking about, no, I don't put it on my arms, I put it on my hands.
I mean, it's there, it is there to provide the SPF protection that you need. I have no problem with it. Only for myself, because with my luck and the way things go, there might be a tiny woven area that's not closed all the way. It may shine through. I would still put SPF on. But, I mean, if you're protecting yourself, or you're trying to at one point. I mean, I'm not gonna say no, but I would just try, whatever's exposed, I would definitely try to cover it as much as possible. I mean, 'cause when I'm at the beach, I do use SPF clothing, and I will tell you, I am out from 10 until 2, even though that is the dead zone. I will not see my significant other if I do not go out there for 2 weeks. So I do go out, sit underneath the chair, but I do have my SPF clothing, but I am covered still from head to toe, because I want to stay cancer-free, melanoma-free.
Questions from folks about either skin problems that result from the cancer treatment or just skin issues in general? They are quiet. I'm curious.
With the skin.
She did great.
With women in particular going through breast cancer treatment and the people who are on the hormone pills for 5 years, like me, or 10 years, it really dries you out.
It does.
And I am really happy that I'm nearing the end of the 5-year period. Or will we start seeing our skin get better after that? I feel like I've been very dry everywhere, just really dry.
Because you're getting this out of your system. So it should be coming better at that point.
I'm just curious, does anybody in the room think they drink enough water? Okay, good.
You know, it's funny, I've always been told, I mean, this is just how I go. Of course, everybody's already eaten.
Does green tea count too?
Yeah, it does, because
I started
it's water.
drinking a lot
Yeah,
of green
because
tea.
there's water in there.
Very little sugar
Yeah,
per gallon.
yeah. It's water, you're still consuming water.
I drink about a gallon a day,
Okay.
and I drink a lot of water when I'm at the still water.
Okay. Well, I always look at how your urine looks like when you go to the restroom.
That's a good, yeah.
If it looks like
everybody.
lemonade, you're getting enough fluids. And I don't know too many people, I mean, I'm just being honest with myself. I don't know too many, as long as it looks like lemonade, you're drinking enough fluids.
I have learned that during all this that, tea or sodas will dehydrate you.
Yes, it will.
But
But
green tea won't, will it?
But I will say, I did bring my own tea with me. And mine actually has properties to help calm and soothe the body, that's what I should have helped, because I knew this heat was gonna come up eventually.
Yes,
Yes, sir.
There's a drink out now called sparkling ice flavored water.
Uh-huh.
Will that be basically the same as drinking water? Anybody in your grocery store?
Probably does.
Water section.
Is it something that you actually poured into, or is it?
It's got carbonation in it.
Oh, does it have carbonation
I
too?
would
check
think.
the sugar in it too.
Yeah, I
What's the
would.
lady- Tell me your first name.
Marie.
Marie, it said watch the sugar in it, just check and see.
It doesn't have any sugar? Does that have sweetener in it? Okay.
Is it in a really skinny bottle?
Some have different
Long,
names.
real skinny?
Hidden stuff in it.
Is it for taste that you're mostly doing it? 'Cause there are some people who do, I mean, I love water. I mean, and I do. And you probably don't like the taste of water. Some people do.
I like it all right, as long as it's got ice.
Okay, okay.
Well, there's so many of the waters now that you can slice cucumbers and the strawberry and get
Right.
limes and lemons and oranges and make your own water, flavored
great
water.
idea.
That's so much healthier than.
Charles?
I drink a lot of green tea. Does it count?
Yeah, that counts. That definitely counts. Again, you're getting fluids and
I use brown sugar.
Yes, ma'am.
Ever since radiation,
Yes,
it
ma'am.
seems like anything on my skin takes forever to heal.
Okay.
Is it, I mean, I know that's normal, but is there anything that you recommend that can help
Actually,
speed
that
up?
balm that I have use that on that. A little goes a long way, but just start doing it. It sounds like if you're, one, definitely there's some damage there to it, but it sounds like you need more circulation and stimulation through that area. So I would try that.
And exercise
Yeah.
will help with that,
It
even
will.
if it's little bits of
Yeah,
things.
it's your movement. Yes, ma'am.
When I was going through chemo, I used, I try to stay away from a lot of extra stuff, but I used coconut oil
Uh-huh.
to moisturize. And my husband's diabetic, and he's using that. So I mean, is that as
Actually, in that balm,
or I mean,
that
is it
balm
something-
has coconut oil in
Okay.
it. So yeah,
Something
I
that's
actually
so
use
good.
coconut oil on my scalp because
Yeah, when I was bald.
Yeah, I do. And especially like during the winter time because, you know, when I make the statement, do as I say, but don't do as I do. I like a hot, really hot shower. So, unfortunately, yeah, feel good. No, so that's what I do. I put coconut oil because I get an itchy scalp. It's an antifungal, so it's really good for that.
So I use retina for acne. So, and it starts peeling the skin and everything, but what can I use for dealing with that peeled skin? Because it's like, even though I scrub my face and everything, during the day, my skin will continue to peel.
And what are you using?
Retina.
You are use retina, okay. You know, and the thing of it is, you might want to scale back on that. And the reason for that, retin-A is not an exfoliant. It actually asks for the cells to multiply. Yeah, it regenerates. So you may, how many times a week are you using it?
I'm using it like 3 times a week.
I would actually, especially this time of year, I would probably scale back to 1. And then, especially during the summertime, you may not want to use it all during the summer because again, it's a heated product and it heats the body. And we're getting ready, we're talking about elements, we're getting ready to go into the fire element, which is winter, which is summer. So, and that's stomach and heart. So we're really activating a lot of inflammation, so we want things that are very cooling to calm things down.
A quick question, oh no, go ahead.
I was just gonna say, when you're talking about coconut oil, that I soak my feet are dry.
Okay.
So I soak my feet in lavender oil and
And
coconut oil.
Oh, well, you're getting a good night's sleep.
And I was wondering, would the coconut oil help him on his face as
It
the
will.
moisturizer?
It will.
For the opposite effect?
It will, but with what he's using it for, I would actually, for him, because of the time of year, I would actually scale back. I mean, that would be my professional recommendation, is to scale back for right now. Because it's almost like a, you can actually get retin-A dermatitis. And again, because the season's starting to heat up, you need to, this is the time of year, it's just to back off anyway.
Okay. Charles, we got one more.
What about olive oil?
Yeah, olive oil's great.
I do olive oil.
I had people tell me that during chemo to put it when my cuticles would split.
Very good.
And it's right
It's all
there in the
natural.
pantry, so
Yeah.
who knew? You didn't have to go buy, you know, a $15 bottle of something. Adrian, thank you so much. And thank you for our treats. And she's also donated 2 door prizes. We really appreciate it.